Hello, it's me again. Now we're in day two post procedure of my cardiac cryoablation at age 30. Um, Day two wasn't really good for me at all. For me, everybody's gonna have their experiences gonna be different. Their days may be better or worse depending on the person. Well, day two for me was pretty bad. Um, wasn't feeling really good that day at all. Woke up. And thought everything was fine. So decided to go out with my wife. We went to go to drop a paycheck in the bank and then go by to see my mom. Um, Went to go see her for a little bit just to shut it out. I'm still doing okay. Um, and essentially, I guess I got overexcited or something and started getting these little wavy of auras in my peripheral when I was at my mom's, and I kind of like started noticing it. And then my wife was like, "Hey, is that happening?" And I'm like, "Yeah, it's happening." So I sat down, and then slowly but surely, my vision started going and it going. So it's similar to something like an ophthalmic migraine for me, um, and essentially, trying to think here that I had to leave. I told him, "Hey, I'm gonna have to go. I'm just not feeling that great." Went home, started having these awful headaches from the back to the front. I was still having a little bit of throat pain, and my jaw was hurting pretty good too. And that was just a culmination of day one to two. I was having some jaw pain, like it was like tightness or something. I'm not exactly sure I could explain that, but uh, uh, from like about 4:30, 5 o'clock to about 9 o'clock that night, I had not. It was nonstop, nonstop headaches. It was just hurting, and then I kept on getting the auras again. They would go away and then come back, and then I started getting nauseous. At that point, I just decided that didn't feel right. Went to the hospital. Of course, hospital was going to be busy, but um, I told them what was going on. That I just had a procedure done a couple of days ago, and I think they kind of fast tracked me to the back to looked at and taken care of. The doctor came in, asked me what was going on, and I told him this is my second day post cryoablation. I had a procedure done, and really bad headaches, and it's traveling down to my jaw. I'm getting nauseous, and it's something similar to maybe an ophthalmic migraine. Um, and they said, well, what we're going to do is going to get some blood work, and we're going to do a CT scan of your head to make sure that you haven't had a stroke. And they did some neurological things for me to check on me visually to see if I have. And I guess I was successful because I everything went okay when they were asking me to close my eyes and put my hands out and tighten my hands around their fingers and stuff. The typical neurological assessment that they do for patients that may or may not have strokes. Um, so the doctor started the IV and did an EKG on me, and everything seemed to be okay with the EKG. Everything's normal. They did the blood work. Once that happened, the CT guy came, but before that, they gave me some Benadryl and Compazine to get rid of my headache. The Benadryl really looped me out pretty good, and then the Compazine kind of did a pretty good job. And then there's like a side effect, I guess, with me. It's just makes you really, really wiry and start over like thinking. I don't know if anybody else has had that with Compazine or Compazine. And but they had to give you Benadryl to kind of counter the effects of what it does. So doctor gave me Benadryl. Immediately, like a minute within that, I started my not vision, but I started feeling really, really out of it. And then the Compazine come in. They slowly gave me the Compazine, and then that was fine. And then about maybe 5 minutes later, it was starting to kick in. No matter what they do, it still kicks in, and it start for me for Compazine after about 5 minutes of them giving it to me causes me to start getting like, if you ever had like an anxiety thing and everything on you starts getting flushed. Well, for me, it feels like there's fire running through my veins, and I started getting a little anxious and want to move around or get the hell out of there, kind of thing. Just like was kind of like panicky. That's the way the medicine does to me. And after that, the CT guy came in, and I'm still dealing with all the medicine that was going in through me, and I was freaking out and stuff. It's like, man, I want to get out of here. I feel like I'm going to die, or I'm going to die, or something like that. That's just weird how the medication does that to you. I've had that happen several different times, a long, long time ago, and went to the CT. I was helped over to the CT place. They scanned my head, went back into on the table, um, and after that went to back to the bed, and went back to the room, shaking, like jittery, shaking like pretty bad. Um, like no less than 5 minutes later, the doctor came in and he told me doesn't look like there's any bleeding in the brain or anything that it needs to worry about. That it seems like that you're doing pretty good with all the neurological things. Excuse me. And neurologically, you're doing pretty good. You just got a really bad headache. So after that, the actual doctor attending came in. He was a British guy, had a British accent, and I've seen him before on my past ER visits a long time ago. So that would put me at ease because I already knew him. So I trusted what he said. That everything looks good. The only thing that they said that in the blood work that my troponin level was slightly increased, but that happens when they go in to ablate your heart. So it's kind of damaging your heart and creating scar tissue when you do that. So there was nothing out of the ordinary there. So he told me that everything looks good. You just got a really bad headache. We're going to give you some Toradol before you leave, and just take it easy. Um, so for the most part, the headache went away. I still had a slight dull, a minor headache in the front of my head, but other than that, I was able to go home and everything. So I left out of there with a good confident, good feeling that everything was good. So my second day wasn't that great. Um, other than that, I've been taking some, not ibuprofen, but it was taking some Tylenol, and they were telling me also if I get those things again right before then, take 3 Aleve or take Tylenol with it. I can't take ibuprofen with the blood thinner. That's not is an antiplatelet medication. That's over the counter. Shouldn't take it. That's just the way the doctor told me. So I'm taking Tylenol with it for all the soreness. Still taking Halls for my throat. My throat is still scratchy, and my chest pressure was still pretty up there. And then on the second day, I was able to take the gauze off, not the gauze, but the bandages off again that eve. Actually, no, I didn't. Wasn't able to. I wasn't able to take my I was so nauseous. I wasn't able to take my medication that night, or take the bandages off because it was that bad. But other than that, this is day 2, post procedure for my cardiac cryoablation. Hopefully, it's a little informative for you. It's just kind of going through what I experienced. Other than that, if you like the video, hit the like button. If you want to subscribe for more daily vlogs of what my experience is and everything, just push the subscribe button and we'll go from there. All right. Thank you for watching. You have a good day.